This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we're rolling, baby. Rolling. Number 50. Yeah, baby. Number 50. We made it to the big 5-0.
All right. That was beautiful.
This is the Berman Method podcast. I am Dr. Jake Berman with my bride,
Jenni Berman, physician assistant.
And we are on number 50 of treating problems and not symptoms. That's what we're all about. David against Goliath. Goliath being the corporate medical system. We're David. We're going up against the corporate medical system because we truly, honestly believe that the corporate medical system is killing your healthcare, because it's driven by insurance reimbursements, and insurance only reimburses for what they deem as medically necessary. And a vast majority of the time, it's not the most appropriate intervention.
Correct.
Right? Vast majority of the time, the intervention is geared towards a symptom, not the problem that has caused that symptom.
Right.
So that's ultimately what leads to, especially elder people, having multiple medications, because you take a medication for this symptom, but that medication has a side effect. So then you have to take a medication for that side effect. And then that medication also has a side effect. So you need another medication for that side effect.
Right.
And you run into it all the time. I mean, at least a weekly basis, somebody will come in with their medication list, and you're going through this list of 10 or 15 things going, what the hell? These 3 things right here are just treating the symptoms of what these other medications are causing. So they're actually doing nothing good at all. If anything, they're doing harm.
Right.
They're actually hurting you. Like, this is crazy.
It is. And it's unfortunately the way majority of the medical system is, which is where we come in to say, whoa. Can we take a step back and really identify where your initial problem was? What was the initial symptom you felt? And can we go back and identify the problem that was actually occurring and treat the problem, not just prescribe a medication to treat that symptom? But as you mentioned, and I'll just go a little bit more in detail, there's medications that people will take that they'll start taking a medication for reflux, and then that medication actually causes certain vitamin deficiencies and can lead to other side effects, like you said, which we have to take other medications for. So it's just this cascade effect of add another medication, when we could have just taken a step back and said, why do you have reflux? You have reflux from likely something you're eating. So can we identify that food or group of foods that is causing an inflammatory response, causing the reflux? And you deal with that also. People treating symptoms and not the problem.
Yes, definitely. So that's what I want to spend some time on today with today's episode is I want to go over some very real examples that we see on a regular basis in the office and talk about how we're going to focus on treating the problem that's causing the thing that X, Y, or these clients are complaining about versus treating the symptom. Does that sound like a plan?
Yes.
Do you want me to start or you?
I have one for you.
Uh-oh.
But it might get you on a soapbox. But I had a patient not too long ago that was complaining about foot pain.
Oh my God.
And it turns out I actually was like, it sounds like you have a neuroma. And she's like, I do have a neuroma. And the podiatrist gave me these shoe inserts. And then, long story short, the shoe inserts and the way she was walking with the neuroma and the shoe inserts to help her pain of her foot.
She's doing air quotes right now.
Yeah, air quotes. The shoe inserts were to help the pain of the foot that was being caused by the neuroma. So then she started having hip issues.
Oh my gosh.
Anyway, long story short, I was like, you really need to go downstairs. My office is right above the physical therapy office. I said, you really need to go downstairs and let them evaluate you and see what's actually going on. What caused that neuroma in the first place? Neuromas don't just happen. And if it was something that was mechanical to your foot, why don't you have them on both sides?
Yes.
So it's not just the fact that you have a neuroma. We got to figure out what caused that neuroma.
Yes.
So anyways, go
So
ahead.
you want me to go now?
Yeah, you can go. I was just, going on the foot, then the inserts, and then the hip, and then.
Yeah. Good. So that's one thing that we do like to talk about in the PT room downstairs in our office is back pain is our bread and butter. Back pain is one of the simplest things that we treat. We pride ourselves on being the best at helping people resolve and alleviate their back pain because of what we're going to be talking about on this episode, treating the problems versus the symptoms. It's not the degenerated disc. It's not the bone on bone. It's not all of these things that show up on x-ray and MRI of your spine. It's the things that are going on around the spine that are causing those things to show up on the x-ray or MRI. But neither here nor there. Let's get back to the foot. The foot is one of my favorite things because nobody likes to work on it. Nobody. So back pain is our bread and butter. However, we specialize in foot and elbow pain because nobody wants to deal with it. And if they do deal with it, they're dealing with the wrong aspect of it. So the foot is so easy to understand once you get the big picture of what's going on. There are over 100 muscles, tendons, and ligaments in the foot alone. And all of those structures have a purpose. All of those structures' purpose is to give support to your foot so that you can accept your body weight through your foot, and then propel yourself forward, pushing off, like as you're walking or running. So all of those muscles, tendons, and ligaments have a purpose. However, when you put your foot inside of a shoe and then you lace up the damn shoe, and even worse, you put an orthotic in the shoe, then lace it up, those 100 muscles, tendons, and ligaments don't have to work anymore because you got the shoe and the orthotic giving, I'm doing air quotes right now, support to your foot. So it's giving external support to your foot. So what happens over the years is, this is the best example of you don't use it, you lose it. Your body is extremely efficient and it requires calories to maintain muscle. That's why you can work out for 5 years to gain a bunch of muscle and tone, and then you get sick for 2 weeks and you don't exercise for 2 weeks, and it takes you almost 3 months to get back to where you were because the body just atrophies that fast. It will actually cannibalize the muscle mass because it's trying to maintain calories, and it requires a lot of calories to maintain muscle mass versus fat mass. So you put your foot in a shoe, you lace it up, you put an orthotic in there. All of those muscles don't have to work anymore. You've got 16 muscles in the arch of your foot alone. There's 4 layers of 4 muscles in the arch of your foot. Those 16 muscles' job is to give your arch support. So why the hell do we need an orthotic? It just drives me absolutely nuts. Like, this just
Boggles your mind.
boggles my mind. But it's $1 billion industry. I mean, you got Dr. Scholl's out there. This is the first time I've name dropped him, but I'm to the point now to where I just don't care. It makes me angry every time I see one of their commercials on the TV because they're amazing marketers. absolutely amazing marketers, but they're part of the contributors of this downward spiral of making the muscles in your feet atrophy. Yeah, you put those orthotics on and your feet feel great. They feel like you're walking on clouds until you have to walk without those damn things. Then it's like, what the hell's going on? My feet are killing me.
Right. Well, and not to mention that if your feet aren't working appropriately and the muscles aren't activating the way they should, then it's causing a cascade effect up the chain with then your glutes are getting weak, the quads get weak. It's a cascade effect once the feet are weak.
Exactly. Look at this example right here. How do we walk if we're walking on ice? Right?
Mm-hmm.
Imagine walking across a frozen lake or a skating rink. How do you walk? Do you walk like you normally would walk across carpet or concrete? Or are you very stiff and rigid because your feet don't have a grip? So your feet are not working. So when your feet don't work and you're trying to walk, it requires you to recruit everything from above the feet. So your quads, your glutes, your core, your back, everything else is working in overtime to try to get you to walk. It's the same thing that happens when you put your foot in a damn shoe and in an orthotic and lace it up real tight. It's on a much smaller level because you're not walking across ice, but the same thing is occurring because your feet are not working. Everything above your feet have to work harder. And that's where this person's hip started to kick into place, because that podiatrist put them in an orthotic to take pressure off the neuroma that was most likely caused because of atrophy of those 16 muscles in the arch of the foot and from lacing up a shoe too tight. So now we're just snowballing in the wrong direction because that orthotic is treating a symptom. The neuroma is a symptom, not the actual problem. The problem is that those 16 muscles in the arch of the foot had atrophied and they're not working anymore.
Right.
So when those muscles are not working, it puts excessive stresses on the forefoot. And that's what causes things to get wonky.
Wonky. Yeah.
Oh my God. Okay, now I can breathe.
Yeah, that was a soapbox. But something else you had touched on was back pain. You guys treat a lot of back pain for people who come in and have had injections already, or they saw an orthopedic or a spine doctor that said they actually need to have surgery or have an ablation. And you guys are actually able to evaluate, where is this back pain actually coming from? Is it directly coming from a certain area of the spine, or is it coming because we're not activating our glute butt muscles? Is it coming from a hip problem or pelvic instability as opposed to actually that disc on the nerve itself?
Exactly. So this one I shouldn't have to rant as hard on because it's so simple. Back pain is so simple. It's not easy, but it is so simple. 9.9 times out of 10, the cause of back pain is glute insufficiency. Most of the time, the glutes are not working appropriately because the core is not working appropriately. So if I wanted to say it all over again, 9.9 out of 10 times back pain is caused by glute and core inefficiency. Doesn't necessarily mean weakness, it just means inefficiency. However, it's not turnkey, it's not one size fits all. We have to go through and assess it and see which glute muscle, which one of the 3 glute muscles on which side is not doing its job, which of the 15 different core muscles is not doing its job. And figure that out, wake those things up, and then re-educate the brain how to use those. And this is all technical stuff that we do on our end, but it's much simpler on the client's end. And then magically, there isn't as much stress or pressure on the spine itself, and back pain goes away.
Right.
Because we treated the problem causing the symptom. Back pain is this symptom. The problem was glute weakness.
And that's the key too, is being able to teach the client how to retrain and get the brain to help the muscles to activate so that this can be a long-term improvement, a long-term fix, as opposed to something like manipulation where it helps for 24 to 48 hours, and then pain starts to come back because you don't know how to do it yourself.
I thought you were going to say 24 to 48 minutes.
Well, yeah, that might be the case.
But in all seriousness, here's the progression of back pain. When we're helping somebody alleviate back pain, it goes in stages. The first place that we have to be able to get you to use your muscles the right way is laying on your back, because it's gravity eliminated. I mean, it's the easiest place to get these muscles firing is laying on your back. Then the next thing we have to do is get them firing standing up, because now you're fighting gravity, but you're just standing, you're not moving. Then the next thing we have to do is get the same muscles firing when you're walking. So now it's more dynamic. So it takes more control and activation and awareness. And then lastly, is we've got to get the muscles firing functionally. So that means bending, lifting, twisting, getting in and out of your car, swinging a golf club, all those other things. So it has to go in that order. And if it doesn't go in that order, then you're working harder, not smarter. And it's just not likely, meaning that using school for an example, you could go through elementary school, you could skip middle school and go straight to high school, and you could probably be successful, but how much harder are you going to have to work because you don't have that fundamental part of middle school, right?
Right.
It goes in an order for a reason. 6th grade comes after 5th because you need to do 6th. 7th grade doesn't come after 5th. 6th does, and it goes in that order. So that's how we do back pain. But we've been talking for a while now. Let's give a couple real life examples that you see most commonly in your aspect of treating symptoms versus problems.
So I think the top two that come in our practice is one, probably the most common are GI side effects and medications to help with gastrointestinal issues like irritable bowel syndrome, IBS, constipation, diarrhea. Patients will have symptoms of the constipation, diarrhea, bloating, reflux, and be handed different medications for these, which we had already touched on in the beginning, cause a lot of other side effects, vitamin deficiencies, water weight redistribution, blood sugar instability. And whereas if we could just target figuring out why the IBS symptoms are happening in the first place. Is it due to a food sensitivity, which is the most common? Is it actually related to a different medication that they're taking, which is causing the IBS issues? So that's one of the most common that we see in the practice.
Hold on. Before you go to the next one, I have to say this.
Yeah. So
what you're trying to tell us is that you are number one in the number two business. But in all seriousness, this is funny because nobody likes working with shitty situations, right?
Right.
It's like nobody in my field likes working with the foot because feet are nasty, they're smelly, they're stinky. Nobody wants to work with the foot. And me and all my guys, we're not scared of the foot at all. Take your shoe and sock off. Let's dig into that thing and start fixing it. Same thing with you. Generally, practitioners don't like talking about shitty situations. It's like, how's your bowels? It's one of the most regular conversations that you have with your clients is, how's your bowels? Yeah. Because it's extremely important.
Right. We talk about it every single week with our clients. And because a lot of things affect bowels, I mean, not getting enough fiber could be a cause of your constipation, not hydrating well enough, not drinking enough water can be a cause of your constipation. Anxiety can be a cause of loose stool. Stress can be a cause of loose stool. And so I had mentioned that food sensitivities are one of the most common reasons for the various symptoms of constipation, diarrhea, bloating, but could also be related to so many various factors. Water intake, stress, anxiety, not getting enough fiber, having too much sugar. Sugar and carbohydrates are a laxative. So having more sugar and carbs in your diet than protein can cause loose stool. Having a lot of protein in your diet without having the adequate fiber or hydration can cause constipation. So there's so many different areas that can lead to your GI symptoms. And unfortunately, it's not known enough by other providers or various providers, but it also takes time to talk about it. And, when we come down to being able to treat problems and not symptoms, that's why the type of practice that we have is to be able to have the time and actually talk about these things with our clients and figure out what is causing the symptom that you're experiencing. If we have the time to go through all the different causes, then we're usually able to figure it out. So that's, we talk about bowels every day, every week with our patients, but we have to. Because if your bowels are off, if your GI, I say it all the time, your gut is your second brain. So if you're having inflammation in the gut, or if you're having constipation, diarrhea, bloating, it's likely that the rest of your system is not functioning as appropriately as it should, but you also have an increase of inflammation. You're not going to feel good.
Yes.
So to go on to the second most common that we see is actually statin medication. So statin medications are used to treat cholesterol problems, high cholesterol. So high LDL specifically, or high total cholesterol, the bad cholesterol, total cholesterol. And statin medications actually have a whole slew of their own side effects, which, the most common side effect that practitioners will talk to you about when they're starting you on a statin medication is the muscle aches and joint pains that can occur with it. But what's not discussed are the vitamin deficiencies and the fact that actually statin medications can increase blood sugar. So you're like, wait a second, I was started on a statin medication and that caused an increase in my blood sugar. So now I'm being started on a diabetic medication, rather than actually just identifying the cause of your high cholesterol, which is directly related to food, high saturated fats in the diet, not getting enough fiber. So fiber actually helps with reducing cholesterol values. So that could be a cause of your high cholesterol values. Not moving your body enough, not getting your heart rate up for an extended period of time each day can be a cause. And then, of course, there are genetic predispositions to high cholesterol, but there's also something called epigenetic expression where we can actually turn our genes on and off. And so you have control, even if everybody in your family has high cholesterol, you have the ability and the control to work against that.
Say that one more time, because this is geared to all of you victims out there saying it's not my fault, it's my mama's fault, or it's my family's fault. Say it again.
You have control to beat genetics.
It's crazy.
I know people don't want to hear that, but it's true. You can, and I was actually at a conference this last weekend. We were talking about epigenetic expression, and you can turn genes off and you can turn genes on. And we mentioned last week, I have a book coming out, and I have a whole part of a chapter talking about epigenetic expression and how you have the control to turn your genes on and off based off your environment, your food intake, your vitamins, your blood levels, your exercise, your medications.
Yes.
Getting off your medications.
Getting off. Can I say something about statins?
Yeah.
So one of the things that I learned back when I was trying to find a diagnosis for you, back when you were in PA school, and when I started reading the book, The Grain Brain, right? Dr. Perlmutter, the Grain Brain. And that's essentially how I came to the conclusion that you had a gluten issue.
Right.
But he does a very good job talking in a few of those chapters about how cholesterol is very important. Specifically, cholesterol is how nutrients crosses the blood-brain barrier. So there's no blood around your brain. It's called cerebral spinal fluid. So your brain is surrounded in this liquid that's called cerebral spinal fluid, and it's not blood. Blood is how nutrients is transported across your whole entire body. So the way that we get nutrients to our brain is cholesterol is the vehicle that helps pull nutrients from the blood and gets it across the blood-brain barrier so that it can go into the brain. And this is very simplistic. I'm describing this very simply, but what I'm trying to get at here is when you're taking a statin, not only does it kill or lower the bad cholesterol, but it also kills and lowers the good cholesterol. The good cholesterol is what gives you nutrients to your brain. So when you're taking a statin, you are decreasing the amount of nutrients that is getting to your brain. So you're essentially starving your brain. And what they're finding is that this is a major, major leading cause to like dementia and Parkinson's disease, these neurological conditions, is the brains are essentially being starved. So we could get on a whole nother rant and rabbit hole on this subject. However, this is a very real thing that nobody talks about because this is very anti-big pharma. This is exactly why we started this podcast, and our businesses were David against Goliath, going against this bullshit, trying to say, listen, this is not right. Just because the commercials that you see on TV from the pharmaceutical companies that are trillion-dollar businesses doesn't mean that it's right. It means that they've got the most money, and they're going to get the message across. Those with the most money get the message across.
Right. Right. And people will say, well, then why did my cardiologist put me on a statin medication? And yes, of course, we need to have low cholesterol for cardiovascular health, but there's many different ways that you can really go about lowering your cholesterol values while also improving your good cholesterol values, the HDL, to create a better ratio between the good cholesterol and bad cholesterol. But it takes effort. You have to want to make a lifestyle change. You have to want to change your life without having to take a medication or the easy way out. And I say that loosely because statin medications really aren't the easy way out, because look at all the other bad things that you're causing by taking them, and then having to take more medications or having a diabetic problem or dementia later in life, which is not easy.
It's not at all.
So you just have to invest in your health and learning how to become more educated, or to become more educated and learning how to live a healthier lifestyle so that you don't have to use these medications. It's an investment.
It is.
Of time and effort.
Yeah. We spend our whole lives working and investing in the stock market and investing in our retirement accounts so that we can retire and have money to live on. However, what does money matter if you don't have your health? Why are you not investing just as much, if not exponentially more, into your physical health versus your financial health?
Right.
Dun, 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 dun. Cool. So that was a good one. Happy 50th episode.
Treating problems, not symptoms.
Yeah, there's 4 very explicit, very common things that we see, at least on a weekly basis, of how people come to us who have been focused on treating symptoms. And then we say, wait a minute, that's not the problem at all. Let's focus on treating the problem, and the symptoms magically go away. Thank you very much for everybody listening to us. Hopefully you are enjoying these more and more as we go through these. Hopefully we're getting better and easier to listen to.
Yes.
I reflect back on the first couple and I'm going, oh my gosh, cringing. Those were horrible. Thanks for sticking with us.
Yeah, we appreciate that. And you can always email us if you have any comments, questions, concerns, or topics that you would want us to discuss. If you have any questions that we can answer on the podcast, we haven't done a Q&A podcast in a while, so maybe that'll be coming up here soon.
We should do those at least once a month.
Right.
Because I did one probably a month ago, I think it was.
Yeah. So you can email Dr. Berman, DrBerman, Dr. Berman at bermanpt.com. And in the subject line, just put podcast.
Podcast question.
And then type your question, comment, concern in the email, and we'll take a look at it.
There's no such thing as a dumb question.
That's right.
Good.
Yeah. All right.
Happy 50.
Yeah. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.